What's the process for accessing CAR T?
The first important part is remembering they exist and having the referring physician remember to send patients our way. Once patients come to our center, they will meet with coordinators, both the clinical coordinators to make sure we have all of the testing, to make sure the heart is healthy enough, the lungs are healthy enough, there's no infections brewing, financial coordinators to take care of all of the organizing if patients are coming from further than 30 minutes, setting them up for a place to stay in the city, transportation aid, all of those things. Once we decide to go ahead and have our collection date set, that sort of starts the actual process. Since most of our patients have had stem cell transplants before, there's that point of comparison. I think one of the most important things to remember is CAR T is not stem cells. So while they're both the cellular therapies, the patient experience is vastly, vastly different. It starts with a collection, whereas stem cells, you need several days of injections and maybe several days of collection. T cell collection is a one-day event. We get what we get, and then we're going to manufacture them, and we can grow them in a petri dish. So there's no minimum, and there's no instigating injections to get them going. Once they're collected, the cells are then sent for manufacturing, which may take from 4 to 8 weeks. And during that time, patients usually receive what we call a bridging therapy, which is some kind of therapy to keep the myeloma at bay, not to get rid of it, but to keep it under control so that once the cells are ready, the patient is also ready. Going into CAR T with growing myeloma can increase the side effects. So
Go ahead.
I give you just the final bit is once the cells are ready, then we plan to give chemotherapy to get the patient's T cells to not put up a fight. That's called lymphodepletion. We infuse the cells, and they're now with us for 2 weeks in the hospital and usually 2 weeks after.
Okay, so I was going to ask how long patients are in the hospital for the procedure. So that explains that. So it's about 2 weeks. And then what signifies that a patient is ready to be released and go home?
So the reason patients are in the hospital is a very classic expected toxicity experience. And so they're in the hospital for us to observe, watch what if it happens, which about 80% of the time, there will be some toxicity for us to address. Once that toxicity has resolved, they're then okay to go home.